So I'm just going to update you regarding the positive cases that we've identified recently. I'm sorry to say that one of the contacts of one of the workers at Binhs Nail Salon is in the intensive care unit at Kingston Health Sciences Centre. We have heard that they are stable, but this re-emphasizes that this disease can have significant consequences. Our whole goal as a community is to reduce the morbidity associated with this and the mortality associated with it. So I'm very sorry to announce that. And our goal as a community is to limit the health effects of this virus and reduce the impact on the hospital, our community, and certainly reduce the risk of death. This person is in the best of hands with our acute care partners. Additional information that's come to light today is that we do have an additional positive worker at George's Nail. So if you remember, we asked members of the community to isolate themselves till they get their test results. Now that we have a confirmed exposure at that site, we're asking that anyone in the community that's gone to George's Nails should isolate themselves completely for the 14 days from their time of their exposure, the time of your appointment. Count 14 days afterwards. Some of you may have already been tested, but you still could be incubating, harboring the virus. And we want anyone that's been to that facility to isolate completely. It's a requirement now for 14 days from the time of your appointment. Our nurses will be following up with individuals to ensure that they isolate appropriately. And if you develop any symptoms, even if your first test is negative, it's important that you get retested at one of our assessment sites. So that's a significant change. It was just a request to isolate till you get your test results. Now that we've confirmed the exposure, it's a mandate, a requirement that you isolate. We have not found any further clients testing positive at Amherst View Golf and Country Club. So we're still just requesting individuals that have been there on June 22nd, 3rd, and 4th to get tested. If your tests are negative and we continue to find no exposure at that location, we will get more confidence that it's fine for you to return to your positions. We have two additional cases today. One is a returning traveler from Europe, and one we think the main exposure is in the Greater Toronto area. These clearly aren't part of this outbreak. Under the Federal Quarantine Act, this traveler is and must isolate for 14 days. Now that they've turned positive, it's an additional 14 days that they must isolate for, and we're following up with them on a daily basis, as well as this individual. So it's not unexpected. We'll get returning travelers from outside of Canada, Canadians coming back that may test positive. The system's working here, and we're confident on this exposure as the cause for them having COVID-19, and there's no association between these individuals and this outbreak. Again, we can't respond to these types of infectious disease threats without the help of our community getting tested, monitoring your symptoms, and isolating where we've asked you to. So thanks to everyone. And we all must remain vigilant, monitor our symptoms, and take the basic precautions of hand hygiene, wearing a mask in public when you can't physically distance, wearing a mask when you go into any confined space, any business, and monitor for signs and symptoms of COVID-19. With all of those precautions in place, we can limit the spread of this virus. We are limiting the spread of this virus and have to thank everyone for all of their work. And we promise again to keep you informed.